nearly 20% of COVID-19 patients developing a mental health issue such as depression, anxiety or even dementia within 3 months of diagnosis, according to new research in the US. Researchers evaluating the health records of close to 69 million people in the US, which included over 62,000 people diagnosed with COVID. Doctors have long suspected that COVID-19 was linked to higher rates of mental health problems. Now, for many people, as I try to bring this home to South Africa, this can always be a time that is gloomy anyway. So how do we deal with ourselves, our friends and family at this time of the year? Christopher Kemp is a clinical psychologist, a regular contributor to this program. Chris, good afternoon to you. So we're at the end of the year. We're dealing with a second wave. We are dealing with financial stress. All of this, I'm assuming, can be a cocktail, a heady cocktail for negative feelings.
Absolutely. I actually think we are worse off now, mentally speaking, or psychologically, or emotionally speaking, than we were at the beginning, because I think there was a sense of hope coming into sort of November, December, that we sort of were over the worst of it. Everyone was looking forward to putting this year behind them. And to be hit with the second wave now and fresh lockdowns, I think that it's been a huge blow for many, many people who are sort of now looking to 2021 not as, you know, the year we're going to put all this to bed, but more of a year that there's going to be a renewed lockdowns, renewed financial and emotional stress. And I think that's really hard because it's crushed a lot of people's hope, essentially.
There was a sense, wasn't there, that we would get to the 31st of December, we would turn the page, and suddenly everything would be all right. But that certainly isn't the case. Are you seeing more people who are experiencing these feelings of gloom and negativity?
Absolutely, and I think throughout the year what I've seen is it just sort of exacerbates existing issues. So people who have been struggling already, or people who were sort of trying to hold it together after what, even prior to 2020, I joke because in 2019 we were all like, wow, that was a terrible year, can't wait for 2020, and now kind of the joke's on us. So I think that for a lot of people it was exacerbating pre-existing issues, and it's come up so much in the people that I talk to, not necessarily entirely COVID-19, but just everything else they have going on. This being on top of that has just proven to be too much, and I think that's sort of been the last thing that's pushed a lot of people past the edge of where their coping skills were at, or where they sort of had the emotional capacity to deal with everything that was going on.
Let's assume, Chris Kemp, that I'm concerned about a family member or a friend or a work colleague. Are there typical signs to look out for?
I'd say absolutely. You know, what I always, because we are all so different, what I always encourage people to look for is changes. Changes in yourself and changes in people that you know very well. If someone is normally very sort of easygoing and you find them to be quick-tempered and irritable, that's sort of a significant change. There's something there, something's up, something is different. So I would say certainly agitation, feeling like you can't cope, that feeling of not being able to get out of bed in the morning, that's to look for in yourself. But if you see that in others as well, absolutely, it's cause for concern. And I think we underestimate the power of simply reaching out to those people and letting them know that we see that we see them, and saying, hey, you're not yourself. Are you okay? Would you like to chat about it? And sort of communicating that it's okay to not be okay.
You used the phrase holding it together a little earlier, but we don't have to hold it together. As you've said correctly, there's no shame in talking about it.
Absolutely. I think the worst thing that we do is sort of insist that we need to be all okay, that we need to hold it together. And that's where we sort of suppress our feelings, and they sort of start to fester over time. I think the more we can talk about this and say, you know what, actually, I'm not coping. I'm doing my best because I have to, but emotionally, I'm not in a great space, and I am really struggling with this, and to share that experience with others and to people who can relate, and to lean on the support systems that we have. I think we often worry about burdening others because we know everyone's going through something, but if we can all lean on each other, then we can sort of create that support. Don't think of yourself as burdening others, and particularly with family members, they know that you're not okay. They feel less anxious when you talk about it than when you say that you're fine, but they know that you're not.
Often more difficult for men to do that in this age of hyper-masculinity?
Absolutely, yeah. I think the whole boys don't cry thing is a long perpetuated stereotype, but also one where men often feel like they need to be the rock, they need to hold it together, they need to be okay, and are less, I would not say less emotional, I would not say that, but less forthcoming with their emotions. If this profession has taught me anything, it's that all of us actually have feelings, and we all have deep feelings. It's just the level to which we allow ourselves to express them to others and actually to ourselves as well.
So finally, acknowledge is the one point that you made. Talk about it is the second point. Is that the blueprint for getting through all of this?
I think absolutely, and I think having a little bit of kindness, compassion, and patience with each other, just empathy would, I suppose, be the third thing there. Just to recognize that in others, everyone's struggling, everyone's kind of doing their best, and yeah, to be patient with others as well who are also in a similar situation to what you might be.
Christopher Kemp is a clinical psychologist. Thank you very much for joining me on ENCA. Now,